In this brief video demonstration, we will look at the basics of coronary angiography. Coronary angiography is an imaging technique for visualizing the coronary arteries. It involves the injection of a radio-opaque dye into the coronary arteries and capturing a series of X-ray images. In other words, videography of a fluoroscopic videography of the coronary arteries is performed as they are being filled with a radio-opaque dye. This procedure provides a detailed anatomy of the coronary arteries and also helps in detecting narrowing or blocks in the coronary artery. This procedure involves passing a catheter into the coronary arteries through the aorta. It is therefore an invasive procedure and has to be performed with appropriate precautions. The procedure for coronary angiography involves catheterization, coronary catheterization. In this, a catheter is passed into the femoral artery and guided up into the aorta, the abdominal and thoracic aorta, into the aortic arch in such a way that the tip of the catheter comes to rest in the coronary sinus. Once the tip of the catheter is in the coronary sinus, it can be introduced into the opening of a coronary artery and a dye can be injected which would make the corresponding artery visible. This procedure is done in a specialized laboratory referred to as the cath lab. Cath lab is equipped with a surgical table on which the patient can be positioned. It has an X-ray source and diametrically opposite to it a camera capable of capturing X-ray images at a high capture rate. In other words, capable of providing a videographic recording of the coronary arteries as they are being filled with the dye. The X-ray source and the camera are mounted on a C-arm which allows the positioning of the camera at different required angles. This allows angiograms to be captured from providing different views of the coronary arteries. There are also a set of monitors which can be used to view the angiographic images even as they are being captured, and also importantly to monitor vital parameters of the patient. Let us now take a look at a coronary angiogram. This image is a still image captured at the beginning of a coronary angiogram. This coronary angiogram has been acquired in a particular view called as the left anterior oblique view, in which the camera is positioned on the left side of the subject with an oblique angle. You can see the vertebral column, which is an important landmark to be recognized in angiograms. One can also see the catheter in the abdominal aorta and in the aortic arch. The tip of the catheter is in the left coronary sinus. So let us look at a angiogram, a coronary angiogram in a normal healthy subject which has been captured in the left anterior oblique view. This angiogram is being played now at normal speed. So as you can see, the injection of the dye highlighted the anatomy of the coronary artery. Let us take a relook at a slower speed. This is the same angiogram being played back at 1/3 the normal speed. As you can see, the injection of the dye fills the trunk of the left coronary artery and then the branches of the left coronary artery. An angiogram therefore provides a detailed view of the coronary artery. You can see the trunk of the left coronary artery, the main stem of the left coronary artery, the circumflex branch, and the anterior descending artery. This is a coronary angiogram of the right coronary artery, which has been obtained more or less in the same view as the previous angiogram, a left anterior oblique view. One can identify the vertebral column, the catheter in the abdominal aorta, the catheter in the aortic arch, and the tip of the catheter now in the right coronary sinus. Take a look at this angiogram at normal speed, a right coronary artery angiogram at normal speed. Replay this angiogram at a much slower speed, at 1/3 the normal speed, a right coronary artery angiogram at a slower speed, and you can see the dye entering the right coronary artery, making its way down the branches of the coronary artery. So, coronary angiograms can provide detailed views of the anatomy of the coronary arteries. Right coronary. The most important use of coronary angiography is in the detection of obstructions in the coronary arteries or narrowing in the coronary arteries. Let us now take a look at a coronary angiogram which depicts a narrowing or obstruction in the left coronary artery. This angiogram has been acquired in the right anterior oblique view, in which the camera or the image intensifier is essentially on the right side of the heart. That is the catheter in the abdominal aorta, the catheter in the aortic arch, and the tip of the catheter in the left coronary sinus. Let's now see this angiogram at 1/3 the normal speed, a slower speed, in order for us to easily visualize the filling of the coronary artery. You can see the dye now entering the left coronary artery and filling its branches. That is the left anterior descending artery, the anterior descending branch of the left coronary artery. That is the circumflex artery. You can see that the left descending artery, the anterior descending artery, is not filling beyond a certain point. There is a narrowing of the artery, and therefore there is inadequate filling or almost absent filling of the distal portions of this artery. This is how a typical narrowing or obstruction in the left coronary artery looks like in angiogram.